What is up, guys? Thanks for watching this replay. Hope you guys are having a great week. I am in desperate need of a haircut. I'm getting a little crazy here. Listen, today I wanted to talk. I'm talking a little funny. My ear is clogged up like crazy. I don't know what the hell's going on. Probably my water stuff over the past few days. Anyway, today I want to talk a little bit about the Glasgow Coma score, scale, whatever you want to say about it, right? There's lots of ways you can kind of study and try to recall these numbers, okay? When I coach people one-on-one to pass exams and stuff, it's one of the biggest things that people kind of struggle with, right? And I have like a long version on how to do that. But what I thought I'd do today is kind of shave it down a little bit and give you kind of like this kind of broad kind of way to look at it specifically for getting it on the exam, okay? Because what happens is that people get stuck and they try to memorize this entire, all the numbers, okay? And it can be difficult, okay? Even today, after doing it for, 30 years or so, I'm still, okay, I can get stuck if I don't stop for a second and think about what the numbers mean. It's pretty easy when you break it down, but when you're sitting there trying to study all these algorithms and your textbook and drug dosages if you're in primary school, EKG stuff, right? You're trying to boil that stuff down, and now you got to deal with the Glasgow score on top of everything else, right? So one thing, when you're sitting for the exam, okay, listen, you can't pull up an app, you can't pull up a card or anything like that, right? And trying to memorize it, okay, like I said, it can be hard, okay? Now, it might seem that you're supposed to memorize the whole thing, okay? The problem is it can be difficult. You can do it, right? But for me, I think you're better off spending more time on the bigger things that you're going to see more of on the exam, right? So there's a handful of things you can do to try to remember what you might see on the test, okay? Now, remember, the lowest score you can get is a 3, not 0. You might think it's 0, but of course it's not, right? It's 3. So that you might see on a test often, right? Any patient that is totally unresponsive, any patient that's in a coma, any patient that's dead, right? You might see test questions about that, okay? And they just want to look, and I think what they're trying to do, they just want to kind of see that if you know that the GCS of 3, and that you understand that a GCS of 3 is at the bottom, okay? They're trying to see that you have that understanding, okay? Now, on the end of that is the GCS of 15, right? That is pretty much all your patients are going to usually, 70% or so of your patients are going to have a GCS of 15, right? And you might see questions about that as well, okay? But you should practice this on your patients, okay? When you're doing your clinical rotations, this to me is the perfect time to practice knowing your GCS, right? When you're seeing patients up front, whether it's in a clinical rotation in an emergency room or on a floor somewhere or on the back of an ambulance, on top of everything else you're doing when you're taking these patients in, take a moment and try to say to yourself, okay, what is this person's GCS? I think that it'll help you as well kind of flow and start understanding when you are actually visually seeing a real patient in front of you, okay? So the 3, right? They're trying to see if you understand that that's the lowest you can go. That is for patients that are dead, they're in a total coma, they're totally unresponsive, right? GCS 15, they're going to want to know that you understand that is the highest you can go, okay? Now, GCS of 14, these are those patients that are confused, okay? Very common score, okay? You'll find a lot of times you'll be scoring patients at 14 when you get them from nursing homes, things like that, patients that have dementia, patients that have Alzheimer's, or you can get that for patients who are intoxicated, right? or even like a minor head injury type patient might have a GCS of 14, okay? So that's something else you're going to see a lot of as well. And then 13, okay, your GCS of 13. This is when those patients are really just not making any sense. They're talking kind of crazy, right? And you'll see questions that kind of lead you along those ways for that as well, okay? Now, the bigger one is patients that will have a GCS of less than 8, okay? Now, this is patients that are nonverbal. Their eyes are closed. They have some basic response to pain, okay? So the eyes and the speech, right? You get 1 each for those two, okay? So now you're just kind of evaluating the patient's motor response, okay? Are they posturing? Do they have, a response to, any kind of control over their motor function, okay? And this is where you're looking at patients that are at a GCS less than 8, and this is what you're going to end up kind of seeing on questions where you might see something along those lines as well. Okay, so these are kind of like the 4 sort of areas you'll see a lot of on the exams. Okay, I think they kind of know you're not going to memorize every little aspect of the GCS. Okay, sure, you're responsible for it. Okay, but they only have so many questions they're going to ask you, and I don't think they're going to be focusing on expecting you to remember every little aspect of that. Again, when I coach people one-on-one, I kind of focus on this handful of stuff here. But at the same time, I have a kind of a bigger spectrum on getting people to kind of memorize the bigger classical coma score, all the numbers, and kind of an easier way to do that as well. There's lots of ways to do it, guys. You can look it up on YouTube if you want as well. Get some ideas there on what might work for you. Okay, even the stuff that I'm showing you now might not be stuff that works for you. And I always tell people, there's no cookie cutter for this, right? You've got to study and learn and train on how it works for you, okay? I can give you ideas. I can give you tips. I can give you, a process, okay? And that's something I try to do when I coach people too. I give them a process, right? And I try to tell them you can tweak that process so that it works for you, right? I can give you a handful of tools. You take those, pick the ones that work for you, and use them. And guess what? Then that's when you're going to succeed, right? Anyway, one last thing when it comes to GCS, just remember the overall numbers, okay? The max numbers you can get. Eyes go up to 4, speech goes up to 5, and your motor goes up to 6, okay? I think if you remember that, along with what I just mentioned before about the minimum being 3 and the max being 15, okay, I think that you'll be able to answer questions that you might see on the exams. Okay, if you kind of remember those time of high points, I think you're going to probably get about 90 so or more percent of the questions right when it comes to the questions on GCS. All right, guys, that's going to be it for me. I'm going to end it there. I hope this really helps out, guys. Listen, I do have a group coaching that I'm working on. It's going to start August 6th. So if you are struggling, man, and you want some help with the National Registry, join me for the group coaching. I'm going to put the link here in the notes. It's emsseo.com/group. Okay. You can go check out all the details there on the dates of the group coaching, all that good stuff. And of course, if you join, the recording of the coaching is there for you in a special members area to access afterwards. Okay. And you can go ahead and join for this group coaching. And the good news is, even though it starts on the 6th, I got a bunch of videos that you can really get into now. All right, that's going to help you when we get into the live coaching, and also help you when it comes to how you're studying and preparing for the exams. All right, guys, I'm going to end it there. Have a great Sunday, man. Stay safe out there, and I will see you on the next video. If you want some other help, be sure to check out the main site. But for right now, go check out that group coaching. I think that if you are really struggling, it could help you out. Okay, don't forget, it starts August 6th. So spots limited. Don't wait till the last minute. All right. Stay safe, man.